Welcome to the program Health and Beyond. In this program, we have up-close interviews with professionals in the health sector to enlighten communities on health-related issues as well as other topical issues beyond health. The program comes face-to-face with people who have valuable information for public consumption. You are all welcome to another edition of the program Health and Beyond, a production of the Communication Unit of the Cameroon Baptist Convention CBC Health Services. I am Clementina and Njang Yong for a presentation. We shall be discussing water, hygiene and sanitation for every child. This June marks the commemoration of the International Day of the African Child. The theme this year is ensuring universal access to water, sanitation and hygiene for every child in Africa. WASH. Water, sanitation and hygiene initiatives are critical to child survival and development, actively reducing deadly diseases like diarrhea and malnutrition. Global organizations collaborate with local governments and schools to install resilient infrastructure, provide emergency supplies, and teach hygiene behaviors through child-friendly educational campaigns. With us here in the studio today to throw more light on this topic are two experts. I would love for them to introduce themselves.
Good morning, dear listeners. I am Coach Jessie Gahbieh. I work with the Cameroon Baptist Convention Health Services as Gender and Inclusion Officer.
Gender and Inclusion Officer, welcome to this program, Jessie. And to my left, we have...
Good morning, listeners. I am Mrs. Tamon, Eveline. I'm the Supervisor of Nursing Services for Queen Baptist Hospital, and I am Infection Prevention and Control Trainer. Thank you.
Those are the two experts that we have here today. We will be right back. Don't go away. Welcome back. I would like to present a message from the Director of CBC Health Services, Mr. Ngum Samuel, to mark this day, International Day of the African Child Message. Today, 16 June, we join the continent in commemorating the International Day of the African Child, a day inspired by the courage of the Soweto students of 1976 who stood for their right to quality education. Their legacy reminds us that the African child must be heard, protected, and empowered. Our work as the CBC Health Services is part of this ongoing struggle for dignity and justice. This year's theme, ensuring universal access to water, sanitation, and hygiene wash for every child in Africa, is deeply relevant to our mission. WASH is foundational to health, and without it, no health system, no matter how advanced, can guarantee the well-being of children. Across Cameroon and Africa, millions of children still lack access to clean water, safe sanitation, and basic hygiene. The consequences are profound, including preventable diseases continue to claim young lives. Poor sanitation fuels outbreaks and undermines community resilience. Girls miss school when facilities are unsafe or inadequate. Health systems are strained by illnesses that could be avoided with clean water and hygiene. For the CBC Health Services, this theme is very relevant and shapes our daily reality. We serve communities where water scarcity, fragile infrastructure, and displacement make WASH a constant challenge. Yet, through our hospitals, health centers, community programs, and partnerships, we continue to stand in the gap for the African child. As the faith-based health system, we are called to be caregivers, advocates, and builders of hope. On this day, we reaffirm our commitment to 1. Integrating WASH education into all community health programs, 2. partnering with schools, churches, and community leaders to promote safe hygiene practices amongst children. 3. Supporting clean water and sanitation initiatives in underserved and conflict-affected communities. 4. Ensuring safe hygienic environment across all CBC Health Services facilities. And 5. Advocating for child-centered policies that prioritize WASH as a right, not a privilege. As we commemorate this day, let us renew our commitment to building an African fit for children, an Africa where no child suffers or dies because of lack of clean water, sanitation, or hygiene. This is not only a development goal, it is a moral responsibility and a reflection of our Christian calling to serve the vulnerable. Thank you, and may God bless our work and the children of Africa. Signed, Samuel Ngum, Director of Health Services for the Cameroon Baptist Convention. We wish to welcome all of you back. We've listened to this message, and we know that we are doing this program today as we commemorate activities to mark the International Day of the African Child. We'll start by trying to situate ourselves by knowing who is a child. We'll start with you, Jessie, as a gender and child officer.
In Cameroon, a child is anybody between the ages 0 to 18 years. So far as you're between the ages 0 to 18 years, you are considered as a child.
Okay, and now we are looking also at water. You know, when we say water, everybody just thinks that when they see the liquid to drink, it is water. How can we qualify good water as we are talking about WASH?
Yeah, good water is water that is colorless, it is odorless, and it is tasteless. A tasteless liquid that is essential for health. Water that has been tested, that is safe for consumption. We can use it for drinking, water that we can use for drinking, for preparation of food, for hygiene and sanitation, and even for agricultural purposes.
Yes, and now talking about the International Day of the African Child, tell us more. I know that the message from the Director of CBC Health Services actually makes us to understand why this day, but I think you can share more information regarding this day.
The Day of the African Child, it's a day set aside to talk about, to advocate for the rights of the child, and to also talk about the challenges that the African child faces, and the inequalities that they face. And each year has its own theme. Last year, we were talking about inclusive education, because it was noticed that when we talk about education for the African child, children with disabilities were left behind. So, but this year, we are talking about children's access to water. So, it's a day that is set aside to talk about the challenges faced by the African child.
Okay, talking about the access to water, what would you say are some of these challenges, especially those that are specific to the African child? For instance, I know there are children, even in the morning before they go to school, they have to go in search of water and very long distances in our communities. Tell us more about this and other challenges that they do face.
Okay. The African child faces a lot of challenges accessing clean water, and it has a lot on their health and their education. For example, in our communities, children, where they go to fetch water, it is very far from their homes, and even the water that is in the communities are not potable. And this causes them to have health challenges, and sometimes they even miss schools because there is no water. And this has a lot to play on the African child. And the CBC Health Services has one of its objectives to talk about advocacy for children with disabilities. And we paid some visits to some schools in the communities to see if they have taps, and if at all these taps are running, and if these taps are accessible to every child. And in all of these communities, all of the taps that were there, most of them were not even working. The ones that were working were not accessible to children with disabilities, because most of the taps are tall and it is not inclusive. Some of them, if a child is in a wheelchair, the child cannot be able to access the taps. So these are some of the challenges that we're talking about in regards to the Day of the African Child.
Yes, you have mentioned some very salient issues regarding the distances, regarding the quality of water, regarding accessibility, especially for children with disabilities. I think there are so many other issues that you may want to add to this, some of the challenges that children face when it comes to wash.
Yeah, we have inadequate infrastructure and broken water systems. Some of the systems are there, but they are all broken, and it's not really comfortable or safe for children to take that. We also have contamination of water because of lack of sanitation. There's a lot of contamination, and you find children are having diseases like diarrhea, typhoid, and it makes them to stay away from school, and it keeps them they are not able to meet up with their developmental goals. We also have climate changes that are coming now. We have some periods of drought. We have some periods of rainfall. We also have financial constraints. There are places that you could really provide potable water, but then how do you go about that? Like, we know some places we can do like maybe boreholes, but because of the limited finances, it's very challenging for us to be able to have that. And we have talked about girls. You know, girls are always sent to fetch water.
Yes.
And sometimes it's difficult. They come back late and they go to school late. And sometimes because of their nature, they have built up, they need some privacy. They need to take care of their menstrual hygiene and so on. And so they really need water. And so it's very challenging. And we see that when these children are faced with these challenges, their health, their education, the children are not safe, and the overall development is jeopardized.
Now, I would like us to look especially when it comes to the Cameroon Baptist Convention, CBCHS services, and its health facilities and the communities where these health facilities are located. Relate us with WASH and the CBC Health Services.
Thank you. WASH, we said that we already established that WASH is water, sanitation, and hygiene.
Yes.
And so when you come to the CBC Health Services, I want to use the example of the Queen Baptist Hospital, which is located at the Finance Junction in Bamenda. You see, we have created a borehole, and we have given an opportunity for the community to fetch water. So the community has access to potable water. And so supplying that water to the community is really engaging in WASH activities. We make sure that those who are around us are able to have water for whatever purpose they want to use. And secondly, it also serves the hospital. You know, in the hospital, we have healthcare associated infections in all hospitals. And because of this borehole that we have, we can be able to clean our hospital so much so that we reduce the rate of infection transmission, because there's always infection in the hospital. And also, we make sure that we clean our hospital, especially the toilets, the sanitary areas. We have enough housekeepers that are cleaning those areas to make sure that we stay away from infection transmission. And also, we have a big program that we do in infection prevention and control, which is hand hygiene, personal hygiene and hand hygiene. So we create a lot of awareness. We teach people on how to wash their hands. I will tell you that 90% of infections in the hospital are transmitted by our hands, and many people do not clean their hands very well. We can use alcohol-based hand rub to clean our hands. We can also use water and soap. And so if we did not have water available, how are you going to clean your hands? Because there are some moments when you will not be able to use alcohol-based hand rub, especially when your hands are visibly soiled.
Yes.
You need to use running water and soap. And so all these aspects are gearing towards the WASH initiative to make sure that we are protecting our communities, we are protecting our children and giving them the good health that they need.
And even this hand washing is something that we have to make even the children to know that it is very, very important, because when we talk about diarrhea and other diseases that are linked with the children, it is because they don't wash their hands effectively. Talking about hand washing, many adults may as well not know how to wash their hands well, but the children too, they have to be taught how to wash hands. I like the fact that you are saying so, and maybe taking us back to the hospital setting, even in the school setting, just as you mentioned, we know that there are so many children in school who don't have the water to wash their hands. And even in some of the schools where they have the water, the children don't even know how to use the water in hand washing. And you have something to say. After that, I would like Jessie to tell us what can be done differently, especially in schools that you visited and the situations that you found in those schools.
Okay, I want to add that the CBC Health Services through the Queen Baptist Hospital has trained staff, nurses who can go out and teach how to do the hand washing and do demonstrations. And so they go to our primary schools, secondary schools around Bamenda and around where all our CBC institutions are found. So this education that they give is very important so that everybody will know what to do to prevent this transmission of diseases. Thank you.
Thank you very much, Jessie. From what you found, what do you think can be done differently?
What I think can be done differently, firstly, is that the schools should intentionally make sure that children in these schools have access to water, and they should, when they want to build their taps, they should use universal designs to ensure that these taps are inclusive. And also, the water should be treated. You know, we visited a school and they actually had water, but the water was not potable. So we had to now get to other people that can assist them to treat the water. And I also want to say that they should not just allow it at the level of the councils, but also we have PTAs in our schools, and we should also intentionally put this in our plans, that we should build taps that are very portable for drinking. And you know, somebody there's this man, they call him from Atanto, that he does water, he builds wells, and he said he wouldn't really advise us to build very deep boreholes in Bamenda, because we tend to meet a lot of things down there that is not drinkable. But that if we can build just wells and treat them, it's going to be portable for drinking, which tells us that it is not as expensive as we think. So we should intentionally make it in a way that our schools should have drinking water, and we should also work with the councils and the other community leaders in our communities where these schools are found.
Thank you very much. Talking about wells, it is something that is laudable if it is well done, so that it's protected, especially we are talking about wells and children and for their safety. I understand, as somebody who has worked in communities, you know the kind of wells that they do put in communities where children can be able to carry water without any risk. Here we are not talking about the local wells that we have in some of the schools. You see, they have to go and draw water from wells, and at the end of the day, you can hear that they have lost a child as a result of this. Yes, would like to come back to you. Even as we talk about water, sanitation, and hygiene for every child, it is very true that in some of our facilities, depending on where they are located, sometimes they try to get water to keep water, sanitation, and hygiene levels very high, but there is always that scarcity of water. What are some of the steps that you think can be put in place to ensure that every facility has good water to use?
Yeah, we can incorporate climate resilient water solutions such as rain harvesting. We can also have solar power water systems, which is very economical. And then we can also ensure that people don't waste water, because sometimes the water is small, but people waste it. And at the point where you really need it, it's not available.
Thank you very much. I remember how we usually even have people who go around teaching us how to use water even as adults, because sometimes you can even flush a toilet and it keeps flowing, and
Yeah.
then you don't realize that the water has a reservoir somewhere that can be emptied through that toilet, and it will be like there is water scarcity, whereas there is water. So that management is very, very important. I would understand that this week, this program is just one of the activities that we are undertaking to mark this day. Other activities took place this week, and Jessie, you were fully involved. I would like you to tell us more about this.
Okay. There were a couple of activities at the CBC Health Services compound, at the CBC compound, and there was a roundtable discussion that was led by the regional delegate for social affairs, and it involved key stakeholders in our communities and also some key child protection actors in the Northwest. And the objective of this roundtable discussion was, first of all, to present a finding that was done. As I said, we visited some schools and some communities to see if they have potable drinking water, and if they don't have, what are the challenges that they face. So one of the objectives of this roundtable discussion was to present the findings of what was done, and then for the key stakeholders to start thinking on what they can do
Yes.
to be able to ensure that these communities have access to drinking water. And also we had children as well as children with disabilities were also invited. And the objective of this was, we cannot be talking about challenges faced by children in accessing water without them telling us the challenges that they are facing. So
Nothing for us without us.
Nothing for us without us. So we had some children as well as children with disabilities that presented some of the challenges that they face in accessing drinking water. And one interesting thing is, one young girl said one of the major challenges she faced was, since she has to walk very long distance to fetch water, sometimes it results to her being harassed because she has to come back late. And we see in our communities now, there's a rise in abuse of the girl child, and which, that is to say, access to drinking water, it is very important for the African child. So that is why we decided to bring in some key stakeholders for their children to talk to them about the challenges that they are facing to access drinking water, and they should see what they can do to ensure that each community has water and that is not far from the children. So that is one of the key actions that was taken during one of the activities that was done during the commemoration.
So will this affect the child only in the Northwest region or in other regions of Cameroon?
We are hopeful that it's going to affect the child in Cameroon, but the key stakeholders that we invited were only from the Northwest region.
We pray that it should be able to influence policy in other regions of the country. They say water is life. Tell us about this. Is it true?
Water is life. Water protects us from a lot of diseases. Water hydrates us. It makes your body safe. And without water, you cannot function well. 70% of our body weight is water. And so we need to be able to maintain that water. If immediately you are dehydrated, you are going into a different situation, and you can even lose your life. And so we cannot live without water because we need it for every aspect of life.
We appreciate so many of the communities that have been taking the engagement actually to ensure that their communities have safe water. As you've rightly said, water is life. We have just a few minutes to go. I would like you to just share your last words, even as we wrap up today's program.
My final message for today is that every child needs access to potable water. Every child needs water, and safe sanitation is very crucial for every child to grow up properly. And proper hand hygiene or hygiene as a whole, regardless of where they live, whether they are living in the rural areas or they are living in urban areas, they need water to be able to function well. And I think that investing in wash is an investment for our children's health, for our children's education, for the dignity and their future. And so let us put our hands together to see how we can make this wash a reality in all our communities. Thank you.
Thank you very much. And Jessie?
My last word is let us all be intentional in our communities in ensuring that all of our children have access to potable drinking water. We should not just leave it for the stakeholders, but we should all take it as a responsibility to ensure that our children have access to drinking water. And also, when we talk about hygiene in our communities, let us ensure that even when we are building our toilets, we should ensure that our toilets are gender sensitive. Thank you very much.
Thank you very much. It has been a great pleasure being in your midst today. We appreciate the valuable contributions of our resource persons, Mrs. Tamon Eveline, who also doubles as the supervisor of nursing services at the Queen Baptist Hospital, even as she works with WASH program as a trainer, and Mrs. Chair Jessie, a gender and inclusion officer. I have been your humble host, Clementina Njang Yong, thanking everyone who has contributed in one way or the other to the success of this program, Health and Beyond, a production of the communication unit of the Cameroon Baptist Convention, CBC Health Services. I want to say thank you all, stay tuned and stay blessed. Bye. It's been the program Health and Beyond, where we have up-close interviews with professionals in the health sector to enlighten communities on health-related issues as well as other topical issues beyond health. The program comes face-to-face with people who have valuable information for public consumption. Thank you for being with us.